In this presentation, I will be talking about the descriptive epidemiological analysis of HIV. I will first start with defining HIV, looking at mode of transmission and risk factors. I will also look at HIV incidence, prevalence, and mortality rates worldwide, as well as countries with the most cases. I will then look at HIV incidence, prevalence, and mortality rates in the United States. And then finally, I will conclude with a timeline of progress that we have made against HIV and AIDS. So, human immunodeficiency virus, also known as HIV, is a virus that attacks the body's immune system, and if left untreated, it can lead to acquired immunodeficiency syndrome. This virus is spread from bodily fluids of an infected person, including blood, breast milk, semen, and vaginal fluids. Behaviors and conditions that put people at greater risk of contracting HIV include having sexual relationships without protection, having another sexually transmitted infection, harmful use of alcohol or drugs in the context of sexual behavior, sharing any contaminated injection equipment or drug solution when injecting drugs, receiving unsafe injection, blood transfusion, or tissue transplantation, and medical procedures that involve unsterile cutting or piercings or accidental needle stick injuries, including among health workers. According to the World Health Organization, as of 2024, there were about 40.8 million people living with HIV worldwide, from which 1.4 million were children between the ages of 0 and 14 years old, and 39.4 were adults, which they define as 15 years or older. As far as HIV incidence worldwide, in 2024, there were about 1.3 million people who acquired HIV. And then HIV-related mortality in 2024, 630,000 people died from HIV-related causes, of which 75,000 of those deaths were children and 550,000 were adults. So here we can see a visual for the data on the previous slide. So the blue line here represents the annual number of people newly infected, and the black line is the annual number of people dying from HIV-related causes. We can see that starting around 1990, there was an increase in both newly infected and deaths. However, around 2005, we start seeing that there is a decline for both, which is more likely due to the use of antiretroviral therapy as well as advances in prevention. On this slide, we see a map showing countries with the highest prevalence among adults. We see that Africa displays a higher prevalence of HIV compared to any other continent, with an estimated average of 3.9% of the population living with HIV. Countries, particularly Eswatini, Lesotho, and South Africa, exhibit the highest HIV rates, which can be attributed to factors like poverty, gender inequality, and limited access to treatment. So now looking at HIV data for the United States, at the end of 2022 in the US and 6 territories and freely associated states, prevalence was 1,108,292 people living with an HIV diagnosis. At the bottom of the map, we can see that the rate per 100,000 people, and we see that HIV diagnoses are not evenly distributed, with a higher prevalence in the South. And I will talk a little more about why this may be in an upcoming slide. As far as HIV incidence, in 2022, there were 31,800 estimated new HIV infections, and the rate was 11.3 per 100,000 people. Men who had sex with men were the populations most affected by HIV, as they accounted for 67% of the estimated new HIV infections. People who acquired HIV through heterosexual contact accounted for 22% of new cases, and people who injected drugs accounted for 7% of the new HIV infections. Looking at HIV incidence by age group, the largest number of new HIV infections occurred among people aged 25 to 34 years old, with 40%, followed by those between the ages of 13 to 24, which accounted for 20% of the new HIV infections. As far as race and ethnicity, in 2022, Black African Americans accounted for 37%, followed by Hispanic Latinos with 33%, and then lastly, with white at 24%. So this map here shows HIV infection by region of residence in the United States. We can see that HIV diagnoses are not evenly distributed regionally. In 2022, among all persons newly diagnosed with HIV, 49% of those lived in the South, 23% lived in the West, 14% lived in the Northeast, and another 14% lived in the Midwest. And this higher prevalence of HIV diagnoses in the South can be attributed by factors such as limited healthcare access, higher rates of poverty, along with lack of health insurance. It could also be due to racial disparities. As we saw in a previous slide, African Americans had the highest incidence, and this may be due to many complex factors. And then lastly, I thought it would be important to add this timeline that shows the progress we have made against HIV and AIDS. In the 1990s, we see that there was a substantial increase in people infected with HIV and dying of AIDS. Followed by the second half of this decade, over 3 million people were infected with HIV yearly. However, since then, the number of new infections began to decline. As for mortality, which is represented by the gold line, AIDS-related deaths increased throughout the 1990s and then peaked in the mid-2000s. However, since then, the annual number of deaths from AIDS have also declined. And then this chart also shows the continuing increase in number of people living with HIV, which again may be attributed to the antiretroviral therapy, allowing people with HIV to live a normal lifespan. And here is my works cited.